before we talk about the event itself on September 27th, I want you to talk a little bit about the American Foundation for Suicide Prevention.
Sure.
Yeah, I know you're the state director, so what do you all do?
Yeah, that's a good question. So the American Foundation for Suicide Prevention was founded in 1987, and it was founded by a group of loss survivors and researchers. And at the time, we really were not researching is suicide preventable. So that's how our organization was formed. We've grown significantly. We have chapters, and several states have multiple chapters. We have about 75 chapters across the nation. And I'm the area director for the Arkansas chapter. Our mission is to save lives and bring hope to those affected by suicide. And really, the way that we do that is through educating the community. So we go out and educate all of our communities, and that looks like educating our students, our school districts, just anyone and everyone in the community, our churches. We just believe that suicide prevention education is for everyone. And then we also do advocacy efforts. So we go and create relationships with our legislators and help them to understand positive and negative effects of legislation around mental health and suicide. And then we do events, annually. We have about 13 events we do annually. And then we do programs for loss survivors. So we know through research that individuals who have lost loved ones to suicide are actually at a higher risk of suicide themselves. And so that's why part of our mission is to help those affected by suicide.
Given the state of mental health these days and the more awareness, how important is it for you all to be doing this along with the effort to improve mental health?
It's really important. Oftentimes I'll meet individuals, I'll be out in the community and I'll share what I do for a living. And I'm almost always hit with, well, I lost a cousin 10 years ago, or I had a friend who died by suicide and I had no idea. And so most of us out there are affected by this. And so the important part of that for us is that we have to be talking about it, right? We have to have that conversation to help destigmatize it, bring it out of the darkness, and make people aware that the first step to preventing suicide is talking about it. And we know that from our research. And so it's really important right now that people understand that and that they know the resources that they have available.
So this Out of the Darkness walk that's going to be on September 27th, is this that effort to bring people together to not be afraid to talk about this?
It is. So our Out of the Darkness walks happen all over the nation. We have 5 here in the state, but the one that's happening in River Valley has a soft spot in my heart as someone that grew up in the River Valley and loves that community. It's an opportunity for individuals to come together to raise awareness around this leading cause of death, and then to also provide support to those who have lost loved ones to suicide. It's a really lovely event in that it walks the line of, providing opportunity to honor those we've lost, but it also is full of hope. It's a family-friendly, community-oriented event. And the purpose behind it is let's come together and talk about this.
What's going to be happening out there that day?
Yeah, sure. So we've got lots of sponsors and community partners that will be out there with us that day. We have lots of teams that are going to come out. So you can register for the event at afsp.org/River Valley. And you can create your own team. There's no fee to register. All the fundraising, this is our fundraising event, and all the fundraising, we ask folks to fundraise on their own. So there's no fee to actually participate with us. I know our police department's going to be out there, being a part of that mental health conversation with us. We've got honor beads. These are a really lovely, interesting part of our events in that if you have lost someone to suicide or you have a connection to suicide prevention, you will have an honor bead that you wear. And the purpose behind that is when you go to the event and you see other people wearing the same colors as you, it's a nice note and a nod to the fact that we're not alone in these experiences we have. So those are just a few things. We're going to have a silent auction. And then, of course, we'll have the walk. And most people, when I talk to them, they're like, how long is the walk? It's not long and it's not hard. It's not really about the walking, right? That's more of a symbolism than it is about us, really getting out there and sweating. So don't stress about that if that's not your thing. It's an easy walk, and it's very much just connecting with the community.
You brought up an interesting point a minute ago about the stigma that is still attached to this. Is that still really prevalent?
It's interesting you asked that because it is. And 4 years ago, when I started in this position, it was even more so. But even in 4 years, it's shifted. People are more willing to talk about this conversation, and people are also more willing to be open to educating themselves on what our research is showing and how we need to talk about it and why that matters. And for me, that's such a positive thing to see for sure.
No pun intended, but what do you hope people will walk away with after this event is done?
I think if there's anything that people walk away with is suicide affects all of us. One loss in a community is a loss for all of us. Everyone is affected by that. And so we all play an important part in preventing suicide. And that can look as big as you come to one of our events and you come to one of our education presentations and you get more engaged that way. Or it can be as simple as you make it a goal during September, Suicide Prevention Month, to connect with someone in the community, or connect with an organization in the community, because we know a protective factor against suicide is connection. And so we want to encourage people to be connected to the world around them.
All right, Jacqueline, thank you so much. We'll see you out there on the 27th.
Yes, sir. See you then.